Hello ladies and gentlemen, welcome back to the backstory. If you're new here, kindly hit the subscribe button and the notification bell down below so that you can be notified whenever we post a new video. Now, ladies and gentlemen, there is a crisis in the health ministry. I don't know if it's by design or it's just by chance. You know, we had the NHIF. Then came the SHA, which came into effect in, is it October last year? Today, during a press conference of the CS for Health, two ladies stormed the meeting and protested, crossed drama by protesting about what has been happening in SHA or SHIF.
Sisi peke yetu tumekuja. There are patients waiting there outside the gate. Wameshinda wakinipigia simu. We've walked in the offices of NHIF. We've gone to all those floors. I've even gone to the ICT department. I've gone to the pre-authorization. They are not able to give us any access. They are not able to get into the portal.
Mnazungushwa ukienda kwa hiyo ofisi go there because they know very well hautasaidika at the end of the day. Unaenda huku na tupoenda huku kwingine. Ukienda huku tunaambiwa tunapress PS who. Haito PS nani ule? Kemani ama ndio nani? Tunazungushwa tu. Can we just get answers surely? Tunaumia. You think coming here tunaumwa, we have to get the courage ufike mpaka hapa.
And you can imagine she has a baby. She was done a CS section. She's supposed to go for review for operation. She cannot do that because of a SHA. Something called SHA. She's carrying the baby everywhere she's moving. She has been there for 3 days. And nothing is being approved. Now you can imagine I've decided to come and help her. And also me, myself, I'm sick. We also have other patients. There are people who could not walk. We have walked all the way from Kenyatta Hospital. Miguu, mpaka huku. Na tumeteremka huko in hiyo NHIF building. Nothing was done. We were not helped. So when we come here, we are coming here as Kenyans. And we are asking for whoever is approving or whatever is happening. Can you talk the truth? And that is all I'm questioning as a Kenyan.
NHIF has been in existence for the last 58 years. Then came the presidency of President William Ruto. They wanted to transform the health ministry and the provision of health services into kind of a national scheme that would provide better services to the country. But apparently, according to what we've been hearing from Kenyans, it's like the new system, which is called SHA SHIF, is not working. Now, ladies and gentlemen, if you look at what that lady has highlighted, it's so sad if this is what is happening in the country. If it's really true that the lady who is in that video had to carry her child and go all the way to the Ministry of Health because she had not been attended to, that is really sad. I think this is something that we should have overcome by now. NHIF had its shortcomings. NHIF had its problems that I can say, but it was somehow working. What we needed to do was to improve on the shortcomings. I don't know why the president overhauled everything. He has his own reasons. But up to now, from the time that we launched SHA up to now, even if someone can say that a new system will always have weaknesses, but I think where we are now, this is now becoming too much. By now, all the technocrats in the Ministry of Health should have found a working system that can help the populace. Because remember, if this is a lady who is in Nairobi, who is suffering this much, who cannot be attended to at this level, what of Kenyans who are in the remote areas? What is happening to them? Because their plight cannot be highlighted. Or is it that we are not being told the truth? Okay, I tried talking to some people and they're telling me that in their regions, maybe in the rural areas, somehow it's working. But the focus of the ministry or the state should be on sealing the loopholes that are in this SHA or SHIF system. my worry is that the focus has shifted from making the system work to registration of lobbying for more registration of members. So however much we want more people to register, but even if they register and the system is not working, how is that going to help? The focus for me should be on sealing the loopholes, trying to tighten the loose ends, so that when you register more people, they find a system that is watertight and able to like help the populace get health services. Because look at this lady, she has a newborn. Did it have to take her storming the health CS press conference for her plight to be highlighted? Were there no other people within that vicinity, within the ministry, who could handle her case? Because I think before she even got there, maybe she went to a desk somewhere in the ministry. She must have talked to someone, 2, 3, 4 people within that building. Does it mean they could not sort her problem? Or is it that Kenyans have given up on all these systems? SHA could be something good, but it's so sad that we're going down this way. I think someone needs to take the bull by the horns. If SHA is not working, if SHIF is not working, then we should go back to NHIF as we sort out all these problems. But unfortunately, the focus of the ministry, the focus of the officials of the government is on registration of more members, because registration of more members bring in more revenue. But for me, I think, as I've said, it should focus on sealing all the loopholes, tightening all the loose ends, so that Kenyans who are hospitalized, Kenyans who are trying to get access to healthcare, can do so without thinking of who to bribe or who to call. It's so sad. I watched that video and I felt really bad. Whoever is in the ministry who can act on this should do it like yesterday. So ladies and gentlemen, that is it from me tonight. Until next time, bye-bye. But if you're new here, kindly hit the subscribe button and the notification bell down below so that you can be notified whenever we post a new video.